Okay, thanks, Tricia. So, if interoception is the ability to sense what's happening inside the body, the next question for us as behavior analysts becomes, how do we conceptualize those internal experiences within our science? As Tricia indicated in ABA, I'm sorry, Tricia, next slide. All right, there we go. As Tricia indicated in ABA, internal warning signals such as fear, discomfort, uncertainty, physiological arousal, or a sense that something feels off are conceptualized as private events. From a radical behaviorist perspective, private events are not outside the science of behavior. They are covert behaviors subject to the same environmental influences as our overt behavior. Next slide. This slide is really grounding us in a behavior analytic problem. Many of the events we are talking about occur within the skin. We cannot directly observe a child's heart rate increasing, their stomach tightening, their breathing changing, or that internal sense of discomfort or threat. Those private events are not available to us in the same way that aggression, avoidance, crying, freezing, or moving away are observable. So as behavior analysts, we often rely on public accompaniments, the observable responses that tend to occur alongside those internal changes. For example, we may see a child tense their body, hold their breath, scan the room, cover their body, move away, become quiet, laugh nervously, refuse, or suddenly engage in challenging behavior. The key point is that those behaviors may not be random. They may be collateral responses that co-vary with an internal state. And when we look at the patterns over time, those observable responses can become important clinical information. They may signal precursor level arousal before the learner escalates, shuts down, complies automatically, or loses access to effective communication. So instead of viewing the body only as noncompliance, avoidance, or attention seeking, we want to ask, what might the body be signaling before the behavior occurs? This is where interoception becomes clinically relevant. We are helping learners notice, discriminate, and respond to those early body signals before the only observable signal left is behavior. Next slide, Tricia. So when learners have difficulty discriminating, labeling, or trusting their internal cues, which is common for individuals with autism or who are prompt-dependent learners, behavior often communicates before language does. The clinical task, therefore, is to identify the early observable response patterns that may serve as proxies for emerging internal distress, threat detection, boundary activation, or physiological dysregulation. And these proxies are commonly grouped together in several behavioral dynamics. Next slide. Escape or avoidance behaviors. One of the earliest indicators of internal discomfort may be subtle changes in approach behavior, such as moving away from a person, leaning back, turning the body away, hiding behind a caregiver, refusing entry into a room, increased hesitation or latency to approach, or leaving the area during social interaction. These behaviors may indicate that the learner is contacting an aversive private event before being able to verbally report it. Next slide. Physical posturing often provides important information about perceived vulnerability or boundary activation, including crossing the arms tightly, shoulders rising to the ears, chin tucked in, curling inward, covering the chest or genitals, or placing the hands over the face and ears. These responses may reflect sensory overload, social threat detection, or an emerging sense of bodily discomfort. Next slide. A learner's relationship to trusted adults may shift when internal warning systems are activated, and examples include suddenly moving closer to the caregiver, grabbing a trusted adult's hand, standing unusually close, repeatedly visually checking for safety or abruptly distancing themselves from a specific person. These behaviors may reflect early safety discrimination. Next slide. Some learners attempt to regulate internal arousal through repetitive or self-soothing behaviors, rocking, pacing, humming, squeezing hands, rubbing the skin, twirling the hair, or increased stereography. Once again, it's important to remember that these behaviors may not represent problem behavior, but rather that the learner's first attempt to regulate internal discomfort is occurring. Next slide. Some of the most clinically significant warning signs are also the easiest to miss. These include the decreased eye contact, the flat affect, the reduced vocalizations, the shorter responses, the delayed responding, freezing, going quiet, or sudden compliance without engagement. This is particularly relevant in safety and grooming context, where some learners do not fight or protest. They disengage. Next slide. However, autonomic responding may become externally visible through the flushed skin, sweating, rapid breathing, repeated swallowing, trembling, muscle rigidity, fidgeting, or foot tapping. These may function as responded precursors to escalation, which could be seen in the form of elopement, meltdown, or severe full-blown crises. Next slide. Verbal behavior may also shift as motivating operations change. Examples include increased demanding for escape, repetitive rule statements, mom said no, excessive reassurance seeking, scripted language, I'm okay, sudden topic changes, or decreased social initiations. Next slide. From a behavior analytic perspective, these observable changes may signal a shift in motivating operations, indicating that the value of escape, safety, or proximity to trusted individuals has increased. Ultimately, again, these behaviors should not automatically be interpreted as noncompliance, avoidance, or maladaptive behavior. Instead, they may represent early observable contact with private events. When recognized and validated, these behaviors provide clinicians, caregivers, and educators with an opportunity to intervene before escalation, while simultaneously helping the learner build the interoceptive awareness needed to eventually recognize, label, and trust their own internal warning systems.